All right, guys, I am back. Okay, another short video. You're probably thinking, thank goodness. All right, so chapter 24 is just primary and secondary procedures. I'm trying to set my timer at 14 minutes at the most. Really, let's go 12 minutes. That shouldn't be that long. Okay, just only to kind of get rid of the housekeeping items. But this is chapter 24. Primary and secondary procedures are just some of the things that you would do in the case of an emergency. All right, so get to know your athletes. And I say this is so important not only for a emergency standpoint, but it's important from a professional standpoint, and it's important for an interpersonal standpoint. Okay, just getting to know your athletes, what they need, and knowing what they need is critical in the case of emergency. Okay, like I said in the previous video, one band, one sound. Every teammate should know everything. Okay, what's going on, what the role entails. Nobody should be in the dark, especially in a medical setting. Nobody should be in the dark ever. Okay, and like I mentioned, most experienced person might take the lead. Doesn't always necessarily mean the most educated. It just could be this person who's been there the longest. They may have more experience in emergencies. Sometimes, for the most part, it could be the team's physician. It also could be maybe the team nurse. Some locations do have nurses, so it just totally depends. They don't always have a nurse because at the end of the day, sports physical has to be signed off by a physician. But we'll get into that later. Okay, another Remind app activity. Making sure I keep track of my notes. Okay, what do the ABCs stand for? Okay, once you have that answer, you're going to text it to me through the Remind app. That way I can give you credit that you participated in today's video. That's the first of 3 activities that you do have to do. What do the ABCs stand for in primary assessment? Okay, a few things before you give chest compressions. Okay, you want to take a look to see if the person's breathing. If there is a pulse, generally, if there's no breathing and there's no pulse, then it might be time to give chest compressions through cardiopulmonary resuscitation, better known as CPR. Okay, and we'll get into the ratios in a second. Okay, especially right now for breathing emergencies, you still need to call 911 or activate EMS. Brain damage can happen very quickly in a matter of a couple of minutes. So you want to respond to them as quickly as a cardiovascular emergency. And getting into CPR, another Remind app activity. Tell me how many chest compressions or the compression ratio is for an adult. Okay, you probably should know this automatically if you have a CPR certification, but I will tell you over the years, I've had a CPR certification since 1996 because I was a babysitter, and the compression ratio has changed. However, this is what the American Heart Association has recommended, and as well as the National Athletic Trainers Association has recommended right now. Okay, so I have not been updated on any changes. So text me what the compression ratio is for an adult when it comes to CPR. Okay, and of course, you're possibly gonna have the emergency of choking. This has been one of 2 emergencies that I've dealt with professionally. The first emergency I've dealt with was someone who was having a seizure, and that one is a little different. Not to get too off topic, but when a person is having a seizure, it's very important that you ensure that there's nothing that is going to endanger them. You don't want to put them You don't want to put them around anything that's going to restrict them. Do not hold that person down during a seizure. Okay, that is not okay. But you want to move things out of the way, making sure they're not around anything that's going to hurt them. And you want to make sure that they're in a position that's going to allow breathing to occur. Okay, you don't want to always lean them back because sometimes seizures can be so severe they can choke on their own tongue. Okay, so you want to make sure that the person is either upright or in a position where their tongue will not will not choke them. Okay, especially if the patient vomits. Okay, so you want to make sure that they're in a position, generally on their side, to ensure that they're breathing, and that if they do vomit, they're not choking on their own vomit. And talking about choking, you can have obstructed airway. Okay, and how you always know someone is choking. Okay, there's two things that indicate whether someone is choking. Okay, the first one is a universal sign of choking. Okay, this is no matter what. The indicator of emergency of choking or an obstructed airway is always going to be this. Okay, and generally, in terms of talking or coughing, there's no air coming in and out. So, and that's what coughing does. Okay, coughing helps us with an obstructed airway. And that can, when we're talking about cases of COVID, what coughing does is that it helps to clear our airway. Same thing when maybe we've had a cold or anything of that nature. So these are just things to just be mindful of in terms of obstructed airway. Okay, this is just a general sign that they cannot breathe and no airway is getting in and out. And of course, if airflow is not coming in and out of the body, next is loss of conscious, and sometimes, if it's extended period of time, there is going to be some brain damage. So treat obstructed airway emergencies basically just as quick as breathing emergencies and cardiovascular emergencies. Okay, cardiovascular emergencies, talking about that, first one for the most part that we're very aware of is heart attack. Okay, or the medical term is a myocardial infarction. Okay, you'll pick up different if you go into cardiac rehab. There's different indicators that kind of give way that someone is having a heart attack or a heart attack is pending. You're going to notice changes in the pulse. You're going to notice changes in breathing. They're lightheaded. They're nauseous. The universal sign generally for someone, there's initially two. Okay, they're going to have some feeling in their chins, in their chest, in their neck, feeling of tightness or feeling of tingling or numbness. Okay, and they're, when they start to feel like that their chin is just tingly. And also another sign, a universal sign, is when a person grabs their arm. Okay, and that's a little bit with referred pain, which we'll get into a little bit later. But those are just kind of general indicators of someone who might be having a heart attack. And in this case, you always want to carry something like ibuprofen. Okay, sudden cardiac arrest, that one just kind of has no indicators. Okay, the person goes down, and at that point, you need to check for pulse or breathing. AED. All right. So AED, making sure I say with my notes because I got 4 minutes left. With the AED machine, it is just an automated external defibrillator. Okay. Again, make sure that you know where this is located. Make sure that the batteries are updated on it, and making sure that someone checks on it monthly, because if it's not used properly, or not used, well, if it's used improperly, or it may have been used recently, or you haven't used it at all and the batteries are just in there, you want to make sure that the batteries are good in an AED machine. There's always usually a backup battery, but you always want to make sure that you check the batteries and check its function every month. Sometimes we did it every 2 weeks, but because it was a fitness center, but every month for the most part. You do need to make sure that this is working and you know where it's located. Okay, hemorrhage is just an external bleed, and you want to apply pressure, you want to elevate it. Okay, there's always going to be a pressure point, and you always want to apply some type of bandage. That's the reason why your AED and your first aid kit need to be close by, and everybody should know exactly where it is. Okay, stitches, remind app activity. Okay, just repeat after me. Any type of wound that requires stitches is an open wound. Okay, just be mindful. Questions like that will be on the test. Okay, so you always want to keep your wound clean. As I said, wounds that require stitches are generally open wounds. All right, remind app activity. Text it back to me. We've heard of MRSA, and MRSA can be serious. All right. So any indicator of MRSA, the athlete does need to go to the physician. And like I said, in the time of COVID, we're wiping down everything. We're hand sanitizing everything. We're keeping everything clean. Same precaution must be taken for MRSA. It's contagious and it can kill. All right, so secondary assessment, we talk about skin color, temperature, whether they can move, how they feel about pain, do they respond well to it, or do they not feel it? Those are just methods of secondary assessment after you've gone through your primary. All right, so breathing is in between 12 and 20. Okay, there are instances again where breathing is not happening, could be related to asthma. As I said, we're dealing with a lot with COVID where breathing is restricted as a result of that, which is extremely scary and unfortunate. That's just pretty much it with rate of breathing. Okay, blood pressure. We always hear about hypertension and pre-hypertensive. So your normal blood pressure for an adult, as I last checked, is 120/80. Okay, and it should be lower from 120 and from 80. Okay, those are just things that as far as secondary assessment is concerned. And I will do my best to see how we can do an activity to take blood pressure, but I will post a video on how to take blood pressure. Okay, and it's very easy. Got two methods of doing it. You can just put the cuff on them and get an automated one and do it, or you could do it the standard. Well, I'm just going to call it a pump because there's a term in there that I haven't had enough coffee to say it yet. So we have your pupil response. And I believe I talked about this in another chapter as far as head injuries are concerned. And as far as like injuries into the thorax, case if your pupils are larger, then that includes death. And I promise you, I did not put in this PowerPoint dead because that's pretty frank. But it's good to know the pupil response in the case of an emergency. Okay, watch, my alarm's gonna go off. Palpations. Whew, like I said, I'm the worst. Palpations. Okay, is just a sense of touch. Okay, touching that individual. Palpations will have to happen, especially if you are, touching for like any type of fluid or bumps or asymmetry, that type of thing. Okay, and what I'm gonna do. What was that? Oh, sorry. My timer is about to stop. Okay, I'm gonna give you one more minute, maybe. Okay, talking about managing fractures. Okay, talked about this in another chapter about fractures and what can be fractured and what to do in a fracture. So it's good to kind of go back and kind of refresh your memory on the PowerPoint slides, not the videos. Okay, we talked about prices and what it means. Here is your PowerPoint, and another video I kind of gave like a just standard Word document, but this is good too. And that's it. Okay, tried to run through it, but again, try not to give too much explanation because I know most students, if you're like me, probably after 15 minutes, I'm like over it. So make sure that you review your slides. Also, you do have the second article that is due by the end of this week, or to me submitted by Sunday at 11:59 p.m. And it's in preparation of your second test, which I'm actually going, as I'm thinking about it, I'll probably give it to you midweek next week. And actually, I'll probably make it available to you probably midweek next week, which is late Tuesday, early Wednesday, and you will have the entire weekend to take it. So I probably won't be as long because of the content, but either way, it's coming up. Talk to you soon.